watching continuing coverage of the World Healthcare Congress here in Washington, D.C. Thanks so much for joining us, and a special welcome to those of you who are joining us virtually. Now, we're going to have some fun here. We have a very special guest in our studio, Dr. Zubin Damania, who has the title of Rapping Doctor. I'm really curious, so strap in. So, Zubin, you're a doctor?
Yeah, and I've never been given the title of Rapping Doctor except by you, so this is a first, and I'm going to take it.
Okay,
and I'm
let's
gonna roll
do
with
that.
It. Yeah, no, the basic story is I'm a physician, I'm an internist, a hospitalist.
Okay.
I worked at Stanford for 10 years in a pseudo-academic practice. Hated everything about our system, and the way that the system works is it crushes creativity, innovation. It is a Greek hierarchical kiss the ring, suck up to authority for your entire career, and then one day you'll be the ring that's kissed. And that is the mentality of medicine. So we get the system that comes out of that, which is a big steaming piece of crap. So as a result, I got very burned out. I had a midlife crisis early at 35 and started as a cry for help putting out videos on YouTube under a pseudonym ZDoggMD with 2 G's, because one is necessary but not sufficient to be a gangster, just so you know.
Okay.
And it's funny to see how uncomfortable she is.
Am
love this.
Am I? No,
love
I'm
this.
chill. I'm really
This is
chill.
why I love people. Fight the power. So in the setting of that, I started putting these videos out on YouTube, and everything from Manhood in the Mirror, which was a parody of Michael Jackson's Man in the Mirror,
Oh, nice.
where I grabbed my testicles repeatedly to encourage testicular self-exam in boys.
Okay.
And what I started finding is people from student health clinics were playing this video on repeat in the waiting room. Kids were getting it stuck in their head and were going home and doing the self-exam. And one of them caught an early testicular cancer. So
wow.
by reaching out to patients where they are, by being human, by not playing all the usual stodgy games that medical people play, we're able to actually make a difference. And so as the video started to grow, I was given an opportunity with Tony Hsieh, the CEO of Zappos, online shoe store. He said, quit your job at Stanford, move your wife, who's an academic chest radiologist, and your 2 kids to the heart of downtown Las Vegas, where I'll give you a little startup money, and you have to try to see what you can do in your own way to make healthcare better, because you're really good at complaining about it in your videos, but you haven't done anything. You're still working this job that you think is broken, where it's a hamster wheel and patients are coming in and out. So after agonizing over that, because I had a nice job, 401k, and the shirt with the alligator on it and all of that, we decided to go for it, and we built a clinic called Turntable Health, which is a new model primary care clinic that is a one-fee sort of all-you-can-treat buffet of care with a team. So health coaches, nurses, licensed clinical social workers, doctors, all working together in service of the patient, but also in service of each other, because that's the piece that's missing. We don't support each other. We're incredibly hierarchical. When something goes wrong, we all point the finger. So we said, what if we changed all of that and we supported each other with compassion so that we could support the patients? And the idea is keep them out of trouble, see them when they're well as when they're sick, get rid of the transaction component of healthcare. So they don't pay co-pays. It's one flat fee that either they pay, $80 a month, or their insurer pays. And our biggest clients were insurers like Nevada Health Co-op, Culinary Workers Union. They said, look, we believe in a model of prevention, we're going to fund it, and in return you're going to show us actual outcomes.
Okay.
Yeah.
How would this be scalable to other places that have those broken systems? What does it take? What are the components?
What we figured out is that you have to do it in a local way, because all healthcare is local. So if you try to do a direct primary care concierge-light model in a downtown Las Vegas setting, it's going to fail. It has to be integrated with, say, Medicaid. You have to do a pilot program with CMS. You can work with Medicare Advantage. But the principles are what we call Health 3.0. So it's basically this idea that you take the sacred relationship of the old days of healthcare, which was 1.0, but it was very paternalistic. Equalize it, make it a partnership with your patients, because your patients are empowered too, and you hold them accountable. You say, you know what, you have to release this victimhood of illness, and let me be the shepherd, but you're in charge, right? So that's one step. The second step is Health 2.0, where we're living now. Click, 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 boxes in an EHR, wearables that nobody wears, quality measures that don't measure quality, carrots and sticks that incentivize the wrong behavior. All those things you have to transcend. You say, yes, the technology is important, but it has to enable the human relationship, and what emerges is this 3.0 vision. And it's very simple. It's just a a vision that you can fulfill locally by saying, okay, we're going to work in teams, we're going to focus on prevention, and we're going to get paid based on actual outcomes that matter to our patients, which means it needs to be physician and clinician led, but empowered by administrators and business people and government officials working together for the common cause, which is improve outcomes on a population and an individual level.
Okay.
Yeah, so you can be evidence empowered, you can have all this evidence-based medicine, but you can't be evidence enslaved. I can't go, well, Mabel, I have to do a mammogram because the government says that if I don't click the mammogram box, I won't get my 99231 code.
Right.
I have to go, let's talk about your concerns around breast cancer. What's your family history? Are you worried about a false positive where we might have to do a biopsy?
Right.
If that worries you, then see us more often and we'll stay connected rather than just reflexively ordering a test.
Are you still in Las Vegas now?
Yeah, we're still in Las Vegas. We closed our downtown clinic, but our partners, Iora Health,
Yes.
took the
With
model.
Dr.
Rashika
Fernando
Fernandez-Pillay,
Pillay.
yes,
Yes.
fantastic human being. He took that model and now he's expanding in multiple states.
Okay.
So what happened in Vegas doesn't stay in Vegas.
Right.
And,
Yeah.
and so what I've shifted to doing is a Facebook Live show that we do every single day. It's called Incident Report.
Okay.
And it reaches anywhere from 50 to 100,000 viewers an episode, and we talk about how to build Health 3.0,
Okay.
taking the news of the day and parsing it through the engine of how do we make healthcare better.
How are your viewers being impacted by what's going on in Washington now?
You know, I would say that there's a lot of discussion about what is Trump going to do, what are the Democrats going to do, what's going to happen to Affordable Care Act, and we've had shows about exactly this. The punchline is, it really doesn't matter because healthcare is a transpartisan issue. If we all say, you know what we want, it's like what Jimmy Kimmel Live said yesterday when he talked in such an emotional way about his child who had a tetralogy fellow
Yes.
heart defect. And he said, you know what, it was about everybody coming together in a team to take care of my son, and if I were uninsured, he might have died in the old days and with pre-existing. It's really about the tribe that we built on Facebook says, no, it's bigger than politics. It's about human beings. And if we can figure out a way in each local version to build that, then we'll succeed. And they're suffering. Like these healthcare providers around the country are suffering. They feel commoditized. They feel like they're working in an assembly line. They feel unappreciated. So we're trying to give them a voice.
Okay.
Yeah.
Are you going to do any rapping?
Today?
Yes.
Oh, it wouldn't be a ZDogg show if we didn't. We're going to do probably a piece on end of life. We're going to do a piece on outpatient medicine and a piece on the calling that is healthcare.
Can you give me a little sample, just a preview?
Sure. So, "Ain't the Way to Die" was an Eminem Rihanna song parody that we did about how we don't have the conversation about end of life. And it's told in two stages. One is the stage of the patient's perspective,
Okay.
stuck in a bed on a ventilator, unable to speak.
Okay.
So it's a sort of spirit figure that's rapping. And then the
Okay.
second phase is told from the point of view of the physician who feels like he's violating his oath to do no harm by
Okay.
torturing this patient because they never had the discussion
Okay.
before the patient was unable to talk.
Okay.
So the patient comes out and he's like, I can't tell you what I really want. You can only guess what it feels like. And right now it's a steel knife in my windpipe. I can't breathe, but you still fight because you can fight. Long as the wrong's done right, protocol's tight. High for drugs, try to sedate. I'm like a pin cushion, I hate it. The more I suffer, I suffocate. Right before I'm about to die, you resuscitate me. You think you've saved me, and I hate it. Wait. So it's something like that.
Okay.
And there's a chorus and all that. But yeah,
Very cool.
it'll be fun.
You're going to be a hard act to follow, Zubin.
I don't know. You guys are actually, dropping mad science. I'm a professional clown, as my dad says.
All right. Well, we look forward to more when we see you up on stage. Thank you so much.
Thank you again. Thanks.
Thank you. And thank you for watching. That's why you need to stay tuned. I'm Mabel John.
And we out.